Good afternoon. Good afternoon. This is Dr. Do again. This video is on alphabetic list of problems, still on letter C. Today I'm going to talk about the chronic joint pain. If you recall my previous video, I have talked about the back pain and some other associated problem like polymyalgia, rheumatica, or fibromyalgia. Those are all associated with the chronic pain. But today I'm going to focus on the chronic joint pains, the extremities and also the back, just emphasize chronic joint pain. Before I talk about the details, first of all, I was thinking any situation regarding to the chronic joint pain associated with the emergency situation, you need to visit emergency. There are some. For example, if you had previously chronic joint pain, suddenly feel there's a burst suddenly, the pain getting worse, especially during the walking or exercise or doing the activities. For example, the shoulder, you have chronic shoulder pain, and suddenly either dislocation or you lift something up and then suddenly feel bursting pain, which means could be a dislocation, could be the muscle torn, could be acute injury or the tendon torn. So this kind of situation you need to visit the emergency. Or if you had previously a chronic joint pain, suddenly feel local feel either knee or shoulder or elbow or wrist, suddenly swelling, red, and or especially with the deformity. Okay, so if that's the case, you also need to visit the emergency. Anyway, these are not quite common, but it could happen because those chronic joint pain, which means there's some chronic irreversible, may have the chronic irreversible damage to the joint surface or to the tendons or the synovial or tissue. So this is the emergency situation. Any kind of chronic joint pain you can manage at home. There's some, but at least you need to, at the first one you notice you had this chronic pain, better to visit your physician usually if you had the chronic joint pain, you probably already visit your physician, already exclusive or from any serious disease, or you just let it go. You thought after your injury you just think you might recover and then becomes chronic. So if that's the case, visit the physician to exclude any treatable causes, either surgery or anti-inflammatory or steroid. If none of those applied, then probably just a Motrin anti-inflammatory from the over-the-counter you may manage at home. But at first, need to see, even though it's not emergency, but at least you need to see your physician to make sure to diagnose or to exclude you had a serious problem or treatable problem. Okay, so what are the causes? Like I said, what are causes for those chronic joint pains? There are many causes. Either can occur in young people or can occur in older people. For the young person, usually the joint pain, chronic pain associated with the remote history of injury, that's the first quite a common cause, or the systemic disease such as psoriasis or colitis, especially the Crohn's or ulcerative colitis, and either celiac disease, recurrent diarrhea. So these are conditions can have the chronic joint pain, arthritis occur in the young people and become recurrent along with the systemic disease. And for the older people, degenerative change, because the long-term erosion on the joint, so cause this chronic joint pain. Or there is some, like I said, remote injury history, probably when you were young, when you were the children, a little child, or in childhood or in the youth, had injury and either treated or non-treated, thought probably will recover, or you just thought it's minor, not worth to visit to see the physician, no swelling, just a little pain, and you just thought I can manage at home, and you did, and eventually becomes a chronic joint pain. So if these are the case, like I said, it's never be too late to see your physician, even though when you had injury you did not go during the acute phase, and now you realize, oh, there's a pain here. See your physician first to diagnose whether it is the newly disease, or it's just the old remote injury now undergoing the changes with age. So these are the other causes, and there's some other like the gout also is possible, or related to the metabolism problem, could become chronic pain with normal or abnormal uric acid in the blood level. The fluctuation of uric acid in the blood is really cause whether there's a flare up or there's a stable or still chronic joint pain. And also there's some deposits, like either new growth of the bones or some calcium deposit in the synovial or the joint space. So these are all the causes of chronic joint pain. Some of them can be managed either through the intra-articular injections. Some of them probably just use anti-inflammatory medications, or the stronger one your physician will prescribe for you, or you can just treat with over-the-counter Motrin anti-inflammatory medications. So as I said, either of those conditions need to be diagnosed first, either exclusive or diagnose whether you have the, like I said, serology negative arthritis, which including the systemic disease like the psoriasis caused arthritis, or the colitis caused arthritis. So this is one group you need to be diagnosed. And if, like the other one, I said remote injury history, you need to talk to your physician at least to make sure there's nothing serious going on. And there's some situations if the joint pain associated with the tingling numbness, that means the inflammation is kind of severe, impaired the nerves. There are some joints, for example, the elbow, especially elbow, the wrist, there's some nerves passing in those next to the joint tissue. So if that inflammation is very severe, could cause the irritation to the nerves, either too tight, like the fibers, because of remote injury history, the recurrent inflammation cause a lot of fibrosis, might cause irritation to the nerves. So if that's the case, regardless, you think you can manage at home, but it won't get better unless you visit your physician, do the surgery to clean up those fibers, so make you feel better, or see there's some other see your physician, other medications to manage the neurological pain, like there are varieties, you probably already know them, like Neurontin or the Lyrica, etc., for the nerve pain. But those medications has to be prescribed, has to be diagnosed by a physician, and they have their indications, like the diabetes peripheral neuropathy can be managed well with those, but the one I said, chronic inflammation caused fibrosis, irritation to the nerves, you need to see your physician. I think the surgery probably just lighten it up or loosen it up, but probably is the best. But these are, by the way, there is a specialist called the pain management, pain clinic. They are the specialist physicians on manage the pain, so they know the criteria, they know the indications, and they know how to treat you, they know how to diagnose you. So if you have the, like I said, chronic joint pain, visit those pain specialists, probably is the best, because they know how to, in addition to your primary care physician or emergency situation like I mentioned, and the pain subspecialist, because they were trained and they deal with pain all the time. So this is the video for today, and I hope it helps. It's very superficial, just kind of remind you, do not ignore, even though it's a minor injury. Go get it checked and then start treated during the acute phase, so we will limit the future complications becomes chronic. If there is emergency, visit the emergency room or see a physician, either ortho or primary or the pain specialist. Well, that's the video for today. It's longer than I expected. Thank you for watching. I'll see you next time.